strategic planning in a total of $4,000.
Let me just read it back to you, make sure I read it. A motion to accept the contract agreement with DK Bosnick for services towards strategic planning for a total of $4,000.
And it should be DK Bozanek Consulting. This is not the individual.
It's just hard,
Yep,
it's so close to
it
the
is.
door, it's hard for me to do.
Okay, I'll second it. Any discussion? Let me know when you're ready, Chris.
I'm good.
Okay, all in favor?
Aye.
Okay. Motion passes.
I'll make a motion then to adjourn the board workshop at 6:26 p.m.
Second.
All in favor?
Aye.
Aye. Anyone else need a time break?
Yes. That will be fine.
Just so you guys know we're live.
Okay, thank you.
Thanks for going slow and letting me keep up. I
Yep.
appreciate it.
I'll go this
I was gonna say, I can get Greg though.
door's locked.
Oh, and I didn't bring my keys, so I'm glad you're here. I've got the man who can open all doors.
You up for me? Oh, I'm not a bar later someplace. Now you know I wear shorts.
Yeah, do you want?
You're sitting
Give it like 2 more minutes.
Yeah, the kids started. Nope. Detroit Lions.
Heck yeah.
Oh man, they have a good game this weekend.
It is.
Plays very well.
Last week, yeah, beat the Vikings.
Yeah.
A little worried about their Aiden Hutchinson. He broke his leg last week against Dallas. He was one of those ugly ones that would show the replay on TV.
Oh, is that the name of the guy? I was watching the game, couldn't remember his name.
Yeah,
He was a beast too.
yeah, he's the best defensive player, so.
Let's see, they still hold it out.
Yeah,
Should they play well? Play very well.
yeah.
I just said. Do you want me to grab the sheet?
Give it like 1 minute.
Okay.
Thanks for doing all the work on this.
Yeah.
Sort of stuff in my job. So just
Two people are joining, where's one of them? So, this is for 200.
Oops, sorry.
No. Just don't want to roll over it.
Okay. Ready? All right, let's call the order at 6:30, please. Pledge allegiance.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Proof of giving public notice.
Notice was given.
Okay, we're all here in person, so we don't need to vote on virtual. Lisa?
Yes. I wasn't ready to that. She gave her report first. There we go. I come today as a parent of 2 district students and 1 future knight in response to the news story 2 weeks ago. I appreciate the positivity from district. As a community member, I am not happy with the news story. While the drone photography of the outside of Hartland North was beautiful, the subsequent picture of a room that I have confirmed does not exist in any of our district school buildings was misleading, inaccurate, and leads to more confusion, not positive outcomes. As a family that relies on special support services, and as an individual who has been involved in global education efforts for over 20 years, I feel compelled to stand before you today and show my support for the best special support staff I have ever met. Perfect, no one is. Best practices, I have seen them. So to those who felt demoralized, you have a pat on the back from me and my utmost appreciation and respect. Regarding the new layout for the hyperlinks in the weekly newsletter, I understand the ease that providing a link for each school gives to families who don't need everything. However, some of us like everything. So would it be possible to have one additional hyperlink that had everything in it so we didn't have to log out and come back in? Because when you're doing it on a phone, and if you have like a professional and a personal Gmail account, and I think maybe you've heard this before, so just a suggestion. Lastly, I am very frustrated with the lack of communication and openness, which I think is leading to rumors and sucking the air out of all of the positive that is accomplished every day in this district. I emailed Superintendent Vogelman early last week, seeking clarification on the policy for communicating to families when a teacher is replaced by a long-term sub. I have not heard back. I don't need to know why a teacher needs to be replaced by a long-term sub. I believe fully in privacy. I also believe I have a right to know the name of a person that is instructing my child every day. A substitute for a week, maybe 2, I understand. Beyond that, it would seem that a short communication, open email saying for reasons that must remain private, your son or daughter is now receiving instruction from XYZ. XYZ is fully capable, brief introduction, a way to contact XYZ, we move on. Instead, I have to receive all information from my preteen. Through Skyward, I currently have a scheduled parent-teacher meeting with a teacher that I know will not be there. Is the long-term sub ready to receive all the questions that will come from families whose teens might not talk so much to them? Are they prepared? Are we setting them up for success on answering why for over a month they've received instruction from someone else? How is that setting your staff up for success? I would have appreciated an email back, a quick call, a one-liner saying we're in the middle of something, but I want to get back to you. That's what I've heard Tina wants to do, and for whatever reason, it just doesn't always pan out. I empathize for her, and I know she has a very difficult job, and I wish her all the best. Thank you.
Thank you.
Thank you.
This is my first board meeting. Can you let me know when it's appropriate to
Yeah.
talk? Like when it's appropriate for someone else to say something?
Did you sign up for a public comment? Okay. So normally when you come into the meeting, you sign up for a public comment.
Okay.
Since is this your first board meeting?
Yeah.
I will let you sign up.
Okay. Thank you.
Actually, I'll just take your name, but I do have one more public comment before you, okay?
Okay, no problem.
Niels?
Hi, Niels Peterson. I unfortunately missed the last board meeting. Really wanted to be here to discuss what happened 2 board meetings ago with the whole Title IX. I watched the board meeting from yesterday. One of the things that I saw that was kind of disjointed when I listened to the board president report from last meeting talking about potential lawsuits and being covered and being safe and the wait and see attitude, I really feel like didn't talk about how personal feelings were coming into the decision making of whether to adopt a Neola standard. And I understand everybody comes to the board with their own personal viewpoint, but I would like to reiterate that if we're going to a Neola standard, and if the Neola standard covers protections that you may personally disagree with, you really should leave the personal disagreements at the door if we're going to a Neola standard. And that's what covers us across the entire policy. So I understand that you may feel personally different as an individual, but hoping that we can understand that federal guidance and federal law can trump that when it does get adjudicated. So when the wait and see plays out, if we could go to the Neola standard without another discussion about your personal viewpoints on something, I think that would be the best interest of the district and the families and the school board. Thank you.
Okay, what's your name?
Laura Fox.
Oh, you did sign up. You just didn't put that you had a public comment.
No.
Okay,
Um,
and you'll have 3 minutes.
Oh, yeah, okay.
Okay.
So I did come to talk about the seclusion rooms that were in fact created. It's 7 by 7, it has a door and a window. It was new construction in this school. The ones that were in the elementary schools are existing rooms that were repurposed into be seclusion rooms. So seclusion, just to give you an insight on what it is, it's when you put a child in a room involuntarily, and then most times they close the door because the child's in crisis. And last year, 100% of the seclusions were to kids with disabilities in this district, and there were only 8 across 3 schools. So 4 kids. So to give you a reference, I come from Elmbrook, and there were 42 last year. So and they don't have private seclusion rooms. So we have a new superintendent, and I agree with what you said too about I've been impressed with this special ed staff. So this is nothing. I was very shocked to see it. And I've been trying to collaborate with the superintendent and with our new director of student services. So I had asked for public records, for permits, to see when this was talked about with the board, when it was approved. And I got a response back that said we have no records, the district considers it closed. So I'm, I guess, asking the board before, and I've presented alternatives also. So there's alternatives other than seclusion. To get a kid in seclusion, you have to physically restrain them also. You have to take them and hold them and move them into a room to use that room. So I've presented alternatives that are working in other districts that reduce staff injuries by 100% and reduce seclusion by 98% and also restraint by 98%. So I shared that in a written proposal to Tina and Dinah last week and then the week before, and I met with both of them, and Dinah's committed to giving 2 weeks to review it, so it'll be on the October 30th to be able to come forward and say, hey, this is what we decided to do with the dedicated seclusion rooms that we've now created here in the school. And so I wanted to involve the board because it's my understanding that the board was not, correct me if I'm wrong, not involved in the initial decision to create these rooms. New build here, existing rooms converted at the elementary schools. And so I wanted to make sure that the right parties are involved in reviewing the alternatives. Because at the end of the day, we all want every staff and every kid to have a great experience. So that's what I wanted to come and share and talk about.
Thank you.
Mhm.
Thank you. That concludes public comments. Okay. We have the 23-24 nursery report.
So I thought I would introduce myself because most of you don't know who I am. I am the district nurse. I started last year and I'm very happy and very excited to be a part of this group. I graduated from Marquette University with a Bachelor's of Science in Nursing. I've done a little bit of everything. I've worked in mental health, I've worked at Children's, I've done cardiac, palliative, kind of a little bit of everything. Was a school nurse before coming here, so I kind of found my way back. And I have 2 kids here, well, one who's graduated. So I have a freshman at Arrowhead and a 7th grader here. So I feel very blessed to be here, very blessed to be a part of this community. We actually moved here for this school district. So I wanted to connect the mission with what we do. And so as you know, the mission is to provide a diverse and dynamic educational program that meets the unique learning styles of all students. So how does that mean for school health services? We support this mission by working towards enhancing education by promoting wellness and facilitating the resolution and/or accommodation of health concerns, youth uniquely for each individual student. And that's really important to me, is that individual student care. So this was our staff. Lori was over at North and Christine was down at South, and then I kind of float between them all. I have an office here. Both of them have retired, so I do miss them greatly, but that's them. Talk a little bit about staffing. You guys employ a one full-time bachelor's prepared registered nurse, which is me, and then at this point we have 2 part-time health aides, one for North, one for South, who worked in between 16 and up to 29 hours a week, often assisting in the office. Both were certified for CPR, and both were trained by me and through modules with the state. They were a vital part of the staff to continuation of care and allow the staff to focus on their primary role of office administrator. So these are things I wanted to do when I got here, because I had this big idea, right? So I wanted to reorganize the records and the medication. I wanted to reduce medical errors. I wanted to ensure that staff on medication administration using state sanctioned modules. I wanted to provide more education for people. I wanted to build relationships with staff and parents. That's still really important to me. And I wanted to transition from paper charting to computer charting, which is always fun if you've ever gone through that process. What I liked about the school, Anne-Marie did a great job. She had these emergency cards that were color-coded and stored with the emergency medicine, making it easy for someone to grab it and to know what to do with it right away versus opening up our PRN or as-needed binder and trying to find all the information. The staff was really willing to work with me, which I was very pleased with. And the medication forms are beautiful. They're complete yet concise, so I really enjoyed it. So every year we have to do our student immunizations. We just finished ours. You have 30 days from the start of school, so 30 school days, to get your information back into the state for that. So, and I know this is probably, and you probably may have heard this, but back in the day, we used to send all the names of the violators, the people who weren't compliant, to the Attorney General, and then they would get a letter from the Attorney General saying, you have to do this or you're going to be in trouble. Well, FERPA just blew that out of the water. So now we only do, I make a list, or basically it's all numbers that I send to the local department. So this can affect immunization rates. This is kind of exciting. So this year there was a change in the law that now we have to have the meningitis vaccine for all incoming 7th graders. Now I wrote this last year thinking that it would create a barrier for like our immunization compliance rate. It did not. So just don't think about that. Improve overall health, and I provided information to all the 6th graders and then also in the newsletter at the time of that. So we got 98.8. I don't know, I think that's pretty good. I think we can always do better. But this year was a change in the requirement regarding the Tdap, which is that tetanus, diphtheria, pertussis vaccine booster that was needed for 7th grade instead of, so they actually moved it from the 7th grade to the 6th grade. And the state average is 89.9. So I'm just gonna toot my own horn, and this year we got 99.2. So, not that it really matters because you can't force someone to respond to you and you can't force anyone to do anything, but it's an interesting game. So, health conditions. Quickly want to talk about, we do individualized healthcare plans for things such as asthma, EpiPens, seizure disorder, type 1 diabetes. So we had a total of 74 students. You can see here that this is North. That North had the most, which makes sense because they're the biggest population. And here's some student health visits based on schools. So this is kind of interesting that in April it was the highest. I don't know why. But you can see here that in January, definitely more kids went home just because of the state of all the germs. South kind of had a different point of view, but then the same thing where they were having, like in February, having more healthcare visits and more injuries. This is sad. North Shore Middle School, once I did Skyward, it kind of went down. And I really think that was because the secretaries were just too busy. So this year we reenacted doing paper charting, which I'm fine with, because I'd rather get the data than not. So this was paper charting, and then this was not. So that's just a little sad, but I did work on it. And here you can see that Hartland North had the most visits. Can you believe we had 5,000 visits? That just blows my mind. Wow. So I did talk a little bit of the low numbers. Students like to call their parents. I guess this wouldn't be a problem anymore, but they used to call their parents before going to the health room. And the secretaries are more lenient in allowing the students to grab an ice pack or a Band-Aid because of that new computer program without having an aid to transcribe. So I'm going to work on doing some more transcribing and looking at a way we can calculate that data more. Increase at North. This place is busy. Age. Sometimes these kiddos just need a hug, and it's the largest school. When those fourth years come in, I just want to. And then we dosed almost 4,500 medications this year. That includes everyday medications as well as needed medications. So that's a lot too. With North Shore actually being a little bit higher than that. So my favorite thing to talk about, medication errors. It's a failure in treatment process that leads to or has the potential to lead harm to patients. So never wanted errors to occur. This actually gave me a lot of time to review the situation, to do an analysis, and to better understand and create a safe environment. In your actual 14-page, it kind of goes through what I did for almost like a root case analysis, where I looked at like the busyness of the health room, other distractions. Was it a special day? Was there a special celebration? Reviewing care plans, looking at education, reviewing policies, educating related to slowing down versus medication administration. That was huge. Showing the 5 rights of medication: right person, right time, right dose, right medication, right route, and exploring aids or cheat sheets to help others understand the medication or the process in everyday language. Sometimes I'll write in nursing handwriting, like P's and S's and all this crazy stuff, and no one knows what I'm writing. So that's something that I actually had to work on as well. Just talking to the student and the parent about errors and taking their perspective and suggesting how to improve the process. So we had 9 missed doses, 1 wrong dose, 1 wrong time, leading to 11 errors. We had 38 last year. So, yeah.
Can I ask you a question?
Yeah.
So the missed doses, I assume, would be somebody who's got a regular medication who didn't get.
Correct.
How do you deal with those? Is it up to the student to come see you, or does like the nurse call them down? I'm just more curious, like how does that happen?
I put it on the provider, I put it on like the health aide or myself to call them down, to hunt them down and to give it to them. Because I don't expect a kid who's taken an ADHD medication to necessarily remember to come and see me. Like today, one kid went out to recess without it, so I just called him down after recess.
So you guys do that every day, basically, you're tracking down kids. Okay, thank you.
I think it's really important.
No, I do too, I didn't appreciate how that would work.
Yeah, no, definitely. So this is something kind of cool. So I got into this idea of how can I prevent errors? So I did this little case study taken to prevent errors. A student had a medication change in which he received 1 pill instead of 2 pills. The same dose, but due to the shortage of medication, the amount of medication needed had to be changed. Because it was a tricky situation, because the aide would leave, there was a possibility of 2 secretaries giving it, there was me giving it. We placed stickers on the medication that clearly noted that 1 pill needed to be given. So we had it on the side, not covering the name, but on the side, and then we had it on the top. And then we had it on our safes, have like a door, so we had a sticky note on the safe And we have a sticky note on the, like our book that we use. And it prevented a possible error and served as an example to other situations. So we continue to do this where we label things by color for different kiddos. If they have like liquid medication and there's 2 of them, one will be a different color than the other, just to kind of slow you down and to think about it. So this is my favorite. I got no ADHD. So that was one of my things when I came here. I was in my last school. We got an award from Project Adam that I was in charge of, so I really wanted ADs. So these are really cool. As you can see in the picture, they actually tell you what to do when you do, like, to press harder, and it'll read if you're pushing hard enough. They're kind of the top of the line, but they're really user-friendly. Our other ones were going obsolete, so it wasn't like I was just purchasing things for fun. And in a stressful situation such as cardiac arrest, one can use all the reminders to save one's life. We also have a bunch of people who are CPR and AED trained, and I just put out another feeler, and like 26 people responded as interested in learning. Yeah. So here's a little importance and blessings of a school nurse. School nurse grounded in ethical and evidence-based practice are leaders which bridge healthcare and education, provide care coordination, advocate for quality student-centered care, and collaborate to design systems that allow individuals and communities to develop to their full potential. So, any questions? Yeah.
Okay, well, first, I think it's amazing that those errors are coming down, and that was great. My question is just out of full transparency, when it happens, I'm assuming if it's after a lunch break, that's not a missed. Would it be one that was missed throughout the day? If that's missed, how is that reported back to the families that are involved?
We call them. So
Same day, or is that a?
Usually it's the same day. I usually get on top of it right away if I'm notified. Like for the one that was missed on the wrong time, it was given like, it was a half day and was given a few hours early. So I gave them a call and they were, you know, I think it's really important to be transparent with our families. So.
Thank you.
Oh, and then also I got to go to 2 conventions, and I really thank you guys for helping me support that. I got to go to the national convention in Chicago, and then the Wisconsin convention in Madison, so thank you.
Thank you.
Thank you, appreciate it.
Okay,
Yes?
Great job.
Thank you.
committee report. PPC,
This month, we are just presenting the 1,000 for review, and then the 7,000 for the wonderful reading of the board on your pleasure over the next month. So nothing new from the committee. We updated all the 1,000s previously, so there was no action on our part. For the 1,000s and then the 7,000s, we both provided information to the administration for them to make updates to the templates, and then we'll bring it back next month.
okay, great. Finance?
Sure. No major capital spending this month. I said I was going to start reporting on that, so we kind of elevate those things. Nothing of that nature this month. I guess, believe it or not, we're already a quarter of the way through our fiscal year. If you look at the budget in terms of percentage, we're generally, costs are running less than 25%, which if you spread out over the year, seems we're below budget, but we've also had 2 months with no kids in school and only 1 month with kids in school, so that's probably a little bit expected. And then the rest of me, we spend a lot of time on the budget, and obviously we think we're going to spend a decent amount of time of that here, so I may chime up a little bit more when we talk about that, but otherwise, Amy's changed some delivery of some reports and stuff for us to provide some additional information, so that's been helpful for me, so I think we're off to a good start.
Great. Okay, consent agenda. We've got employee personnel report, monthly voucher and purchasing card report, school board meeting minutes from September 19th, and donations.
I'll make a motion to approve the consent agenda items.
Second that.
Okay, any discussion? Let me know when you're ready, Chris.
You can go, I'll catch up.
Okay, all in favor?
Aye.
Aye.
Okay, consent agenda is approved. Okay, we're moving on on to Neola policy discussion and decision for the 1,000 series, second reading, and the 7,000 series for the first reading. Anyone
I promised I was gonna read them, and I did. So I had 2 questions on the 1,000, which I didn't read before the last meeting, and I know it's their second reading. So here's 2 questions. One, it's on page 7 of the PDF, but it's section 1213, student supervision and welfare. And bullet J in there talks about that administrators are expressly prohibited from posting pictures, videos, memes, whatever, pertaining to a student on personal or unauthorized social networking media or similar forums. Sounds good in theory. My concern is we already post, I mean, we post a lot of pictures and things, and it goes on to say that students can be in pictures if they're taking pictures of events, right? We have kids posing as student of the month and things of that I'm sure we don't reach out and get every parent's permission for. I just want to make sure we're not, it's a Neola policy, and I know a lot of school districts do it, so I assume it's not an issue, but I didn't know if that was something you guys talked about or anything we concerned about, or.
We didn't, but when I read that, Matt, it says on personal. And so that goes
Well,
out
it
on the
says personal or
schools.
unauthorized social networking media, and I don't really know what that "or" means. So I thought that as well with the personal.
Okay.
Look, I don't think we should change it, I just wondered if you talk about it. I mean, I know all
We
school
have in the
districts do
past.
it.
So there was some discussion in the past with Tina on it, and this was a long time ago that we had just talked about it in general. I think it came up in conversation. It wasn't about the discussion of the policy in particular, and it was that the administration and teachers know if there are parents that have concerns about their children being posted on any even district page. So the administration and staff are aware of those students and then intentionally keep them out of the photos.
And don't we have to sign some authorization as parents to allow depictions of our children to be included?
Oh, do we?
Yeah.
Okay, good.
So
Okay.
maybe your wife was signing that for you.
That's probably it.
Just speaking how my household runs.
They do take concern though over anyone that has a problem with it, and then they will avoid including that child.
No, that's fine, I just did want to put a policy in place
Yeah.
that I know we're
But-
not adhering to on a daily basis with these newsletters and Facebook posts and whatever, so.
Yeah.
Okay. Then the second one is just something I'm sure you guys need to add, but in section 161901, there's kind of placeholder for,
161901?
yeah, it's on page 42 of the PDF. There's 2 blanks in there where we're supposed to appoint somebody to have a responsibility here, and they're just still blank. Most of the other times, it's like Amy or the district administrator or something, so I just want to make sure. I don't care who it is, I mean, somebody will think through who the proper person
So
is
the
to do
privacy
it.
protections of self-funded, is that one that's not applicable? Because we don't do self-funded?
Yes.
So that's why. So policy 1619.01
Yeah.
is not applicable, because we don't do any self-funded group health plans, that's why there's a blank.
Okay. That one's not on, that wasn't even on our list. So it
Okay.
must have been just.
Yeah.
So you don't X it
It
out.
should be deleted.
Oh,
In fact, maybe
ultimately
that should be a
deleted.
point moving forward, is it
Maybe
should
it's
just be
moved.
removed from our policies.
Okay.
You were thorough.
I told you I'd read it. I mean, I wasn't making it up to make you feel good. That's it. That's all.
Okay. So I'll make a motion then to approve the Neola 1000 series as submitted with the note to remove non-applicable policy like 1619.01.
Just give me a second. So is it fair to say that you motion to approve the 1,000 policies as presented with a note to remove policies that are not applicable?
Correct.
Thank you.
Second.
Discussion? All in favor?
Aye.
Aye.
Okay, 1,000 series is approved.
Do we need to make a motion on the 7,000? Because it's the first reading, right? And so we can just talk about it and then?
Yep.
Okay. Motion to move on.
Anyone have anything for
Are
the
there any that
$7,000
came out of your
series?
comments that you guys had?
Most, just so you know, a lot of the 7,000 series, just so as you guys are perusing them, are policies we didn't have before. A lot of them are technology, social media, et cetera, specific policies, and they were reviewed at length by the IT team and then shared with the PPC committee. And then we reviewed their information after, and there was very little. Some of it was clarification, a couple of questions on process, but not anything in depth related to the position of the policy, if that helps while you're reading it.
Okay, moving on to Director of Business Services report. Amy?
Yes. All right, first up is the monthly financials. Excuse me. Fund 10, General Operations, revenue received in September. We did receive our first equalization aid payment of $832,000. We had interest on our savings account at 5.57%, which was almost $21,000 for the month. And then the rest is tied to school fees, extracurricular activities, things of that nature. For expenses, everything looks good. At this time is on budget. For Fund 27, which is our special education, that does have to zero each month. So the revenue received this month was just the inter-fund transfer from Fund 10 to Fund 27, which was $189,000. Again, expenses look good at this time and on budget, so that program is running well. Fund 46 is our capital improvement fund. Right now, that is just earning interest on our account there at 5.57%, so that was just over $7,000 for the month. Fund 50 is tied to food service, and that is just food service deposits for families for their students. At this time, we will be doing a claim this month for September, so we'll start seeing some other revenue come in at that point. Fund 81 is our community service, which is our Lakeside Academy, the daycare program. So all of that is tied to their revenue and expenses. Revenue is for their fees for services, and then any expenses for staffing and things. But again, everything looks as it should. Are there any questions on the September financials? This is the big topic for this evening. So I do have a presentation on the budget and tax levy. I do have to thank Chris and Matt as the Finance Committee. They did let me practice with them on Friday and give me some valuable feedback, so thank you. So just kind of review for tonight, the agenda is to review the proposed budget that we will be presenting. We'll also be talking about the tax levy, that goes hand in hand, and then hopefully, if all goes well, the board will approve both the budget and the tax levy this evening. So I'll start with the budget. This kind of came up when we were talking at finance, so I was trying to find a way to visualize what this looks like. And something I've heard others say is funding buckets. So really each fund has its own bucket of revenue and expenses, and they don't really mix together. So when you think about the funds, they are very much separate, which I think actually Matt came up with, which really helped me for visualizing this for everyone else. So when I'm looking at the budget, I thought this time I would go what the changes were from the preliminary budget that was presented at the annual meeting to now. So when we look at that, Fund 10, general fund changes to highlight. The tax levy did increase. The equalization aid, which is the state aid or general aid, did decrease. And then I was able to roll over some ESSER funds, about just over $100,000 to spend over the summer. So that did help with some professional development, curriculum, and things of that nature. A new expense was our student services director. Since that position is doing not just special education, but some other programming like guidance, ELL, and things of that nature, we are splitting that between Fund 10 and Fund 27. Fund 21, that is special projects. It's really used for fundraising and donations received by the district. These funds automatically roll over from year to year, which is great. We don't lose track of them. They don't go into a general fund balance. Some examples of these funds that you probably hear us talk about more often, angel funds is something that people donate to every year. The Hartland-Lakeside Education Foundation does so much to support our programming. So that is run through Fund 21. And then extracurricular activity fundraisers. So like when Student Council has a dance like they just did, any money they raise from that and any expenses for that run through a Fund 21. Fund 27 is our special education. The highlights I wanted to make from the preliminary budget to now, I did reduce the special education aid. As you may be aware, the state said they were going to give districts 33.3% of funding. Based on actual from 23-24, it turned out to be 32.4. So I did drop that in my budget to 32 to be a little more conservative, to being closer to actual. Obviously, I hope they get closer to 33, but with the funds available, I'm assuming it will still be around 32%. For special ed, we did make some new hires. Some were just in the personnel report tonight. But we had 2 special education teachers that we brought into programming, 3 special education aides, and then the other 50% of that student service director. Fund 46 is our capital projects fund. Right now, because that money sits in its own account, we are just earning interest on that. Like I said, right now it's 5.57%. Interest rate, as you know, is going down, but hopefully we can still earn a decent amount in that account. We do have no expenses at this time. The potential transfer would come at the end of the year. If we do have a surplus, we can transfer from Fund 10 to Fund 46 to help fund this account for future use.
Can I chime in on this?
Oh, sure.
So a couple of things here. One, no expenses. It doesn't mean we're not doing any capital improvements this year. We're planning to replace a roof. And the current budget for that is $350,000. So when we had presented a budget, the preliminary budget, there was a $250,000 budgeted line item to go in as a revenue into capital projects. We're not budgeting to put that in there because we're going to actually spend money this year to actually replace the roofs as a plan. But that expenses, if it costs $350,000, we're paying for that out of our operating. So that capital fund, which still has all this money, is still earning interest. So I think it just goes to show how conservatively and prudently we're kind of managing the district's finances to be able to fund a $350,000 project without tapping into this, what is it, $1.6 million or whatever we have in the fund. So while we're not looking to add to it in a budget line item, it's because we're making a big change there. And there was no expenses last year in that fund either. And we did the library improvement, we've done some parking lot work, we've done a lot of work over the last couple of years without tapping into that. So I think that's important for the community to understand.
So what we hope to do is to continue to build those funds for future capital improvement projects.
It's okay, I'm just curious if I have questions, do I wait till the end?
Or
no questions?
There's no questions. If you do have a question,
Okay.
you are welcome to email.
Follow up? Okay.
Yes, absolutely.
Okay, thanks.
So we just hope to continue to build this capital improvement fund in case there are some major renovations or something that needs to be done at a future time that wouldn't fit into a Fund 10 general fund. I'm working closely with Greg, the Buildings and Grounds Director, to identify those areas of improvement. We did do some walkthroughs over the summer, so we are going to update the 10-year facility plan too, and try to put an emphasis on time, what needs to be done first, rather than trying to be reactive, be more proactive moving forward.
Is there a timeline on when that might be presented to the board?
There is, and I can't remember where it fits in our 12-month
Generally,
plan right
like
now.
in the next month or in the next 6 months?
It would be in the next 6 months.
Okay.
I know November is pretty packed already,
Sure.
so it would be after the November meeting
Okay.
sometime.
No, that's fine. I just wasn't sure if there was a timeline associated with it or if it's just something that's worked on in the background.
We're working on it in the background, but we will bring it to the board as soon as we can.
Thank you.
Matt did highlight some of these.
I forgot you put in the slides,
It's
so
okay.
I just stole your thunder. I'm sorry.
So, as Matt said, it's great that we've been able to use Fund 10 to do some of these major projects. As you probably have seen, we've done some parking lots here at the middle school as well as north over this last summer. We've done some major door replacements, some carpet replacements and things in the classroom, and then of course that library renovation, which is the pictures I selected. And then for 24-25, the big project right now is the roof replacement. Fund 50, so that is our food service. The revenues for that is the family deposits into student accounts as well as our federal food service aid. And then all of these expenses are tied to Chartwell's, which is our vendor who provides those services. And then I am able to use those funds for food service equipment replacement and things. Otherwise, it has to be tied to food service. So these funds, again, just stay in their bucket. And then Fund 81, it's called a community service account, and that's why Lakeside Academy is in there. They do receive deposits from families for child care services, and then all of their expenses are tied to the staff and supplies for that programming. They are 100% self-sustaining, so they don't receive any funding directly from Fund 10 or the community other than what is provided by those families. Matt actually did the math for me on this one, so thank you, Matt. Which was great because we were looking at what is the budget. When you look at the budget, it's an over $20 million budget, but really when you look at that, because of the buckets, the money that the district has, I guess, some control or expenses tied to is really for Fund 10 and Fund 27. And when you look at that broken out, just over 86% of that is tied to the revenue limit. So the revenue limit is that state general aid and the tax levy. So most of our funding comes from that. Excuse me. The other 6.1 is state other aid, which would be per pupil aid and some state grants and funds. 5.8 is from our open enrolled kids into our district. 4.5% is other state, which would be the special education. 3.7 is federal aid, which is really those grants again. And then 1.9 is other resources. So that is tied to school fees, interest, things of that nature.
Is the 3.7 tied to the food services?
Mm-hmm.
No, because this is only Fund 10 and 27.
Yeah, I mean, the thing that's been helpful for me is like they talk a lot about this per head charge, and I was always doing the math, and I was like, what? You say we got a $20 million budget, and you do the per head charge, and it comes up to like $13 million. Like, where's the other $7 million coming from? This doesn't make sense to me. Part of it is we run the daycare, the Lakeside Academy through this. That's $1 million. That 20 then goes to 19. Another part of it is the special education. So while we do have those buckets, the buckets do overlap for special education in the sense that since that fund has to balance to zero and we don't get enough government aid because the state pays 33% of those costs, we have to pull money from our general account to pay for that, the additional special ed, and it has to be run through a separate account. That, what we pull from that is $1.7 million. So that $1.7 million is basically double counted. Okay, so it's counted in revenue and expenses in our general fund, so it nets to zero. But then it's revenue as well over in the special education fund. So so if you go from, you take out the Hartland-Lakeside Academy, you go from like 20 to 19. You take out this 1.7 that's double counted, you go from, you're down to like from 19 to, I have the numbers here, I'm trying to do the math in my head, but you're down to like 17 and a half. And then food service is about $500,000, but that is also all self-contained. We either get the federal, is it federal or state money for the food? It's federal money for the food program, and then the rest is students buying lunch and whatever we collect from that. So you take that out, we're basically a $17 million district to basically provide the basic educational stuff for our school. Where I think that's important is that special education transfer is $1.7 million. So 10% of our budget goes over to special education, right? And the state government requires us to provide all these services, but that funding is dropping, 33%, 32%. Our special education needs aren't dropping, so that continues to go up. And so there's a lot of angst around school boards going out for referendums, right? But we have to take every special education student who comes to our door. Private schools don't have to take those students, so they can say no. And private schools can sign up for a program where they get 90% of their special education costs covered. So if we were to ever have to go out to referendum, if the state would just treat us the same as the private schools, we would have $1.7 million, 10% of our budget on an annual basis that we wouldn't have to pay for that would come from state funds. Okay, so when you're talking about an Arrowhead referendum, so that's, I'm talking about it because there's a lot of focus in this district around Arrowhead and its referendum. There was a study done by a state senator, I think it is, where basically somewhere in the neighborhood of half the districts that went out for operating referendums, or maybe it's more than that, I have it written down somewhere. If the state had just funded special education at this 90% rate that private schools can get out from, a lot of these schools would never had to go out to operating referendums, right? So if you're worked up about something about the state funding, and that guy who was here earlier during our workshop was talking, it's not changing, live with it. Well, they're elected too. He said we need to deal with stuff, and it's like, if you really want to get on something about state funding, there are winners and losers if they do the funding formula, because we're underfunded compared to some districts. There aren't winners and losers with the special education funding. Like, those are at-need kids where districts are forced to provide all these services that they cannot afford to provide. And so if you want to get upset with your legislatures and push for something to use their surplus for, that'd be a very good opportunity to argue for that, because those as I said, those private schools do not have to accept those students, and they can, so if you got a family here who's got 4 kids who 3 don't have special needs and 1 doesn't, and they want to go to private school, the private school can take those 3 kids. We lose $11,000 a head, we lose $33,000, and we are stuck with a special needs student who we have a lot of additional costs for. So just to show you kind of where we're at in that thing, I think it's an important thing for the community to understand if we're ever in need of funding that, yeah, that's broken, but it's really broken in one major piece for some really at-risk kids.
And that relates to Fund 27, the report that you did, the additional staffing and the additional spending, and I'm saying this more for the community's aspect, but that came as a result of our changing enrollment. There was a different enrollment than what was predicted. There were higher needs, and so we had to allocate more funds to do exactly what Matt is talking about. So when you see that and those funding issues and challenges that we have, that's exactly the reason.
And pay attention to that 86%, because you're going to see in a slide or two that what we spend our money on, about 75% of it is our staff.
Yep.
Right? So basically, the property taxes kind of cover the people that show up, and maybe some additional programming for books and some other things. And the rest is at the whims of these other grants and other things that special education, 33%. I'm sorry, this year we're going down to 32%.
So then we also did an expense summary for just 27, because again, that's most of what we have say and control over. So salaries and benefits are about 68% based on those numbers. Purchase services is our other biggest piece. Purchase services is a difficult one because it includes transportation, it's our open enrollment kids out, professional development. It's a big category with a lot of odd things in it. So that's why that's also a big piece of the pie. General operating is just supplies and things to keep things moving. We did put the roof in there, just so you can see that's 2% of the overall budget. Oh, we did have open enrollment.
I backed it out, right?
Yeah.
Just to show. I mean, part of backing it out is, if you do the math, it's a smaller percent. this pie is of the same $17 million, right? So open roll out 7, I think a slide back, or open and roll in is maybe like 4 or 5. You know, we are a net loser in the open enrollment world. Eyes wide open on that, so.
Yes, no, you're absolutely right. And then 2% is everything else. So as Matt said, salaries and benefits is typically most of the expenses for any corporation or school district. And then purchase services is also our biggest piece of the pie. So just in summary, because this was a lot of information, so the overall budget change, I know I threw some numbers in there in the beginning. The budget did increase by $287,000 roughly from the preliminary budget 2 months ago, but the budget is balanced, which is great news. On to the tax levy. Yeah.
We have decision, it says discussion and decision.
Yes.
Or-
I was just going to do the presentation and then you guys can talk about each piece and I can answer anything, if that's okay.
Yep, that's fine.
So for tax levy, I just wanted to kind of do a reminder where we left off in August. Information that we were waiting for at that time was the third Friday pupil count in September. The equalized values that we receive from the state is October 1st. And then what the state is going to aid each school for equalization aid or general aid, we receive on October 15th. So this is all a quick turnaround time. But that is basically determines, the equalization aid is what determines what then goes to the local taxpayers. So first up, September pupil count. I am happy to report that it was higher than we originally projected. So September's FTE came in at 1,087 students. And then our summer programming, even though we did 2 weeks less, actually ended up with more FTEs. So we went from 55 last year to 64 this year. So that was great because this all goes into the revenue limit calculation. Also wanted to make some highlights. As you may recall from last year, we went from just over 10,000 to 11,000 per member. With the state's budget this year, we were able to go from 11,000 to 11,339. So every dollar counts. Unfortunately, but it does bring more money into the district. We are in declining enrollment still. So you can see that rolling average for the 3 years. So we did receive 15 FTEs for declining enrollment as well.
Understand that 11,339 is the absolute lowest you can possibly have in the entire state of Wisconsin on a per pupil charge. We get the absolute lowest that the government will pay to any school district in anything. We got the boost from 10,000 to 11,000 because we were so much below other districts, and they made a law that basically the lowest it will be was $11,000. So we got a, whatever it was, $920,
which was huge.
Huge boost, but we are underfunded and compared, we are unable to levy tax dollars outside a referendum to a tremendously disadvantaged amount to some of our neighboring school districts.
So I just wanted to do a side-by-side comparison. So you could see at the annual meeting, that was the top line that I had presented at that time. As of October 15th information, you can see the revenue limit did go up a little because of that student FTE was up. But you do see that the state aid came down. Unfortunately, Hartland-Lakeside is a property-rich area. So when you look at something like this, at one of the conventions I went to, they said it's kind of like a seesaw or a teeter-totter, however you say it. So the more state aid you get, the less that goes to the taxpayers. But because we're property rich, the state gives less because they're trying to be equal and try to make that equal across the board for 420 districts. So that did increase the overall revenue limit levy for our community. So when you look at a 3-year comparison, you can see that in 22-23, even though the dollar amount was less, The mill rate was 3.43. Last year, we were down to 3.34, so we did go up just a little bit, about 2%, to 3.41%, or 3.41 mill rate. So, next steps, hopefully, we're going to adopt the 24-25 budget. And then hopefully the board approves the tax levy by November 1st, because that is the deadline. Then the levy is certified and is due out by November 4th. And then I need to submit forms to the local municipalities by November 8th. Are there any questions?
Did you want to present the calendar as well first, or?
No,
Okay.
we can just talk about the budget or the tax levy. I think I had the budget first. So are
Yep,
there any
budget's first.
discussions on the budget?
Great job to you and Matt on putting this together, and Chris.
The only question I had was on line 47 of the budget, which refers to federal sources coming in into Fund 10, which I had in past years earmarked as being Medicaid. So it's sub-account 780. And I just noticed that back in 22-23, we had 162,000. I'll give you a minute to find that on the
Nope,
budget.
I
Oh,
found
okay, okay. And then last year was 44, and this year it's down to 25. So I was wondering why that was decreasing. Is that related to COVID expenditures, or?
That would be my guess, just I obviously wasn't here the full
Okay.
time.
Right.
Like, I don't know why it's decreasing.
Okay.
It is the portion that goes to Fund 10, which is limited. Most of it does go to special education. So I would have to do a deeper dive in to find out why that might be decreasing, but I could certainly try to figure that out.
Just curious, because I know as a parent who's gone through this, is we sign permission to allow the district to bill Medicaid for services supplied to our students.
Yes.
So I wasn't sure if that was part of it as well, as if we're just having less people or less students who are eligible for us to receive Medicare,
Well, I
Medicaid
think in Fund
expenditures.
27, it's a little closer to stable, but it probably doesn't show well in this report.
Okay.
Um,
So this specific line, because it's in Fund 10.
It's only for,
It's not for our kids who have an IEP then?
no, it's
For a
usually
standard
because of
student
an
population.
adjustment, and that's the only time it can go to Fund 10.
Okay,
Um,
okay. I was just curious.
mhm.
Okay.
Anybody else on budget?
Madam Chair, I'll motion to approve the 2024-2025 budget as presented.
I'll second that.
Discussion? All in favor?
Aye.
Aye.
Okay, 24-25 budget is approved.
And then, just a reminder, the tax levy at this time, if we levy to the full authority, is the $8,777,893.
Do we need to approve that here?
Yes.
A motion to approve the revenue tax levy of $8,777,893.
I'll second.
Any discussion? I'll give you a second, Chris. Are you ready?
Adjourned.
Okay, all in favor?
Aye.
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 24-25 tax levy is approved.
The final piece, at this time, we do need to approve the budget calendar for next year. So that is in board docs. The only change was moving the annual meeting from August to September, as that is what was approved at the annual meeting in August. Otherwise, the calendar remains the same. As you can see, the tax levy will be put in November, and then December we start all over. So, are there any questions on the budget calendar?
I move to approve the 2025-2026 budget calendar.
I'll second it. Discussion? All in favor?
Aye.
Aye.
Okay, 24, or 2025-26 budget calendar is approved. wanted to make a quick statement. We've had a lot going on in our district recently. And this is, you know, in reference to the multiple things, not one specific thing. And I'm hoping people are out there watching as well, so. I'm aware that community members often have specific concerns that they want addressed by the district. In most instances, these concerns should be brought to the administration's attention for resolution rather than the board members or during public comment. However, it is important to understand that there are several reasons why the district can't provide details regarding the steps that have been taken to address specific concerns. For example, neither the administration nor the school board can violate student privacy laws by disclosing information contained in student records, such as specific disciplinary actions taken against students other than someone's own child. In other instances, there are other legal considerations that prevent the district from commenting, such as the involvement of law enforcement or threatened or pending legal action against the district. Please understand that while we often can't provide these details, the administration and the superintendent take all of your concerns seriously. And then the other thing that I would like to say, because I am increasingly concerned about it, is the tone and harsh language that's been contained in criticisms leveled against the district, the administration, staff, and even students in some cases these past few weeks. This language is crushing the spirit of our district that everyone has worked so hard to achieve for years. Our district is nothing short of fantastic, as shown not just by the recent national recognition we have received with the Blue Ribbon Award, but by the amazing things our students and staff do every day. I recognize that there are always areas where the district can improve, but such concerns should be brought to the proper person's attention in the spirit of collaborating to make improvements. Tearing people apart on social media or in person will not help solve anyone's problems. We all need to work together to maintain the district's excellence, and we all need to model the type of district we would like to be. So I implore you and thank you for those who are part of all of this collaboration. So with that, we need to schedule our next PPC meeting.
Oh, sorry, discussion items? Future discussion?
Oh, yes, sorry,
Yes,
skip right
no,
over that.
No, just in the interest of making sure we're capturing all of our enrollment students.
Yep.
Something that I've brought up before, but I think we've disagreed as to how much of the new subdivision is going to be in with our district boundaries. I think we should really look at that sooner rather than later, since they're doing a build on it. So the new quarry district. Because when I look at it, there's like 3/4 to 2/3 of the buildings are going to be in our district. And so,
Yeah, it's massive.
right. So I want to make sure we're just being proactive about reaching out to the people in that settlement, in that subdivision.
Doesn't it just happen, or do we have to like lobby? I don't understand. Like, I figured there's like lines drawn, or is it like?
Well,
is
there
it-
are, but, so one question is can we advocate to have the district boundaries changed? Because if you look at it, it's a one-way in and out, so trying to get buses for 2 different districts into the one subdivision, right?
Are
Because
you-
part of it
are
goes
you-
into Lake Country.
Are you thinking the lines are drawn such that it would be part in 2 different districts?
It
that
is.
what it looks like? Okay.
It is. So that's part of it.
Okay.
But just on another issue is parents have choice, right? So yes, any families with young children who move into those new apartments are automatically going to be in our district, but as we know, we lose on open enrollment out. So that's why I was thinking about trying to find a way to be proactive to make sure that we keep as many of those students in our district as possible. Just in terms of outreach or whatever we can do.
Yeah, it's a discussion to figure out lobby for moving the lines, or the, I mean, I understand the whole point. I just, is there an avenue to do that? I just don't I know it's part of the discussion
I'm willing to
today.
research it. If
Well,
people are
I know, this came in front of the board a few years ago, but it was a group of people on a street
That wanted to change
that
or
wanted
something.
to get out of our territory and into the smaller
Right.
territory.
Right.
So I only know it from that avenue, so yeah,
Right.
well, in terms of a board wanting, we'll have to look into that, yeah.
Yeah. That was it.
Okay. Anything else? PPC?
So we're meeting on Monday, November 18th.
Oh, you're that far. Oh, you mean for the school board, sorry.
For the school board, right, so probably meeting the week before, the week of the 11th. Again, Mondays and Fridays are always best for me. I don't know what your schedule looks like.
Sure, let's do, Monday, I could not get here before 5 p.m.
How about the Friday before the 8th? Just trying to think, doing things in the evening can be hard for the admin.
True, but I have a full-time job.
I understand.
Friday, the 8th,
Mm-hmm.
and then be 5 p.m. I'm an all-day training.
Okay, okay. Then I guess.
I can do,
two-
again, if you guys want to do 6:30 in the morning, let's do
Right,
it.
and she has to drive up here from like Geneva. Okay,
I'm just giving you what options I have.
okay. Well, you want to do Monday, the 11th at 5 then, and we'll see what,
Yeah, and I might be able to move it up earlier, so we can, as long as we notice at least a handful of days in advance, we might be able to move it up earlier to help accommodate the administration's
Yeah.
schedule.
and sorry, I can't do that Monday evening.
Oh,
So Friday, the
the,
8th at 5 o'clock?
yes, that would be, yes, that'd be the earliest, that'd be coming in hot. The only downside is it's an all-day training, so you never know if it ends on time or not. If it ends up late, then I might be late.
Okay.
Unless you guys want to go early in the morning. Do you want to leave it to be determined and schedule it with Tina to see if she prefers an evening or a morning?
Do we want to put two options on there and let Tina be the tiebreaker?
We certainly can, but then there's no sense in setting it on the agenda for today. Like an either or. I mean, I guess we could.
So we could do, so we could do Friday, November 8th at 5, but I can't do a 6:30 in the morning meeting because I already have a early Friday morning meeting. Or we could do Monday, November 11th then, at 6:30.
November 11th. And are you morning, right?
Yeah.
Yep, I can do that. Again, and I apologize to the rest of you, but I have a roughly an hour drive as well to work, so I have to try to get it in early enough so that I can actually get to my job too. So we'll put those to her and see what works better for her. And again, if there's something else that comes up that works better for everyone's schedule, we can always do that. As long as we notice at least with enough advance, we're fine.
Sounds good.
Okay. And I'm happy too to entertain if you guys want to look at like a permanent time. We could try to come up with a permanent one. I know it's just difficult with our schedules, but.
We had been doing it okay at like 10 o'clock on Mondays, but I think your schedule
Yeah, my
changed.
schedule changed now where we're back almost full-time, so
Yeah.
to sneak out, not sneak, but take my break
Yeah,
for an hour or so in the midday is pretty much gone now.
yeah.
Okay, we're good.
Okay, finance?
November 15th, 9 a.m.
Look at that.
You're making us look bad.
It's on board docs already.
Yeah.
Printed different.
Well done.
You're good with that, Chris? You're-
Yeah, we were
Oh, you
all
already
good.
did, all right, awesome. Okay, so we have board workshop Monday, November 4th, and regular school board meeting, November 18th. Just to touch base quickly on some of that stakeholder feedback date stuff that was in the proposal. Obviously, that's not 100% set in stone, but do you guys foresee, we were really hoping to, you know, get the ball rolling here so that we could have like a decent framework by January.
I agree 100%. I mean, we've been talking about this for months. It's time
Right.
to do it, so let's.
I mean, the staff feedback is obviously, that is
I think that's the most important one. I think with this community forum we're talking about, I just think we need to give enough time to get it set up. So whether it's that November date we
I think
give,
it's
or it
November
slips,
14th.
or it slips a little bit, I don't know if that's as crucial.
Where are we at with SWAT meetings? I know I'm all scheduled with my crew, and I think the latest one I'm doing is November 1st. Is anyone past November 1st? I think people are, but.
November 4th, I just emailed you today.
Yep,
We're waiting for middle school and IT just to get back on their dates.
okay.
I thought we had November 6th.
Is that what it is?
Yep.
Yeah, November 6th. Oh, yeah. but I
So
sent
we're
it to you.
still prior
We're
to
still
that?
scheduling, but yeah, we can.
Okay.
So, 5 o'clock start. I should be able to be here by then, on November 14th.
Okay.
Oh, you know.
November 14th?
Yes.
Well, that's in the scope of the services for the strategic planning contract that we approved tonight.
I'll be questionable. I'm in Green Bay that day. So if I'm back in time, I can. It's a long drive. I don't know if I can be back by,
Are you there for conferences?
no, for work.
Oh, okay. I was gonna say, skip it.
No, it's for work.
Okay.
Look, my only point, I think we should give the community enough notice so they can do it, and I do think it's important that all 5 of us are there for that, so, I mean, I don't.
Okay.
Well, I mean, I mean, I enjoy working with all of you. I trust you. So if I can't be the part of a meeting, that's fine. We can always record it and I can watch it afterwards.
Well, no, it's not what they're talking about.
It's like the fair where you would be
Oh,
manning a booth.
that's the one you're
Yeah,
talking
that's
about,
the
that
one we're
one.
talking about.
5:30 to 7:30?
We can do it. I cannot guarantee. Again, it's a 2-hour drive and I can't promise that there won't be accidents, travel issues.
If there is a better date for you, throw it out.
Monday the 11th.
November, I think that's
I
moving us
can't.
too close.
To the, to the community
Yeah.
participation. And to try to do it before the 18th?
Yeah. I guess we were, you know, we were talking that like, you know, once December hits, it's gonna be crazy for people.
But
And,
does it have to be prior to the 18th school board meeting? Can't we do it later on that same week?
no, it does not.
Oh, so
Well,
following
like-
the day.
I mean, I think that's what we were trying to shoot for, but it really, I guess it really does not matter. The workshop is November 4th, so it's happening after the workshop. So I don't really want to use a regular school board meeting to go into all the strategic planning stuff anyway. So that would be fine on my end. I just have to get with Danielle and Tina.
So the week of the 18th, I would be good the 20th through the 22nd, if it's evenings.
20th through what?
22nd, Wednesday through Friday?
I couldn't do Wednesday, but I could do, I mean, you wouldn't want to do Friday. Friday would be the Friday before the weekend before Thanksgiving. You hear people bailing out.
Oh, actually, we're on vacation. We have 4 days, don't we?
The following.
Oh, the following.
Yeah.
Okay.
So Thursday night, the 21st?
Yeah.
Okay, I will bring it to.
And just because we also have community members who might be coming in from work, can we maybe look at pushing that back to start time of like 5:30 or 6 rather than 5?
Yes.
Or is that too late for the consultant? But I think for.
I don't think so.
Okay.
I'll find that out.
Yeah, look, I mean, I think we're gonna get participation. You gotta push it into the evening a little bit.
Right.
People aren't gonna take a day off work to come.
Oh, trust me, they were suggesting day, and I said, no, we can do it at night. We always do everything at night. We gotta
Yeah.
stay consistent.
Yeah,
Okay.
Okay, so push it to 5:30 or 6
yeah.
On 11/21.
on 11. Okay, I will get back to you guys on that.
Okay.
I'm just putting it in my calendar for now.
Okay. Okay, I'll make a motion to adjourn to closed session to discuss administrative goals pursuant to state statute as outlined in the agenda.
Second?
Discussion? Okay, I roll call on this one. Chris Hassett.
Yes.
Amy?
Yes.
Chris Haglund?
Yes.
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 Okay, we are in closed session. Thank you, guys.
Thank you.
Thank you.
Thank you very much for coming.
Okay,
Night.
thank you.
Loved your presentation, Andy, and your enthusiasm.
Oh,
Thank you.
thank you.